2024 manifesto MPP and Dr. Mahmoud Bawumia apa hon entomano die na womuma ya pomuden the health aspect of the 2024 manifesto. Dr. Anthony Nsia Asare eboakwaba
ya eja miracles
doc bibi aboko de
nyame da woro man ne mpa bo bibi aboko
ya da masenso ene edwumaden amaye akyekyere manifesto kama sei amaye nti ne ye bedidi nkomo kakra na ansa ne yebeba manifesto no so ankasa kra no ye pese obobo ne tofa kakra no twamfoni kakra maye ya yaresa ne ya pomuden nsem na ankasa no etesan asat 2016 na ene no Dana Danko Kufa Dr. Mahmoud Bawumia empempen so be na yetumi atama ba bedru ansa kra obeche Dr. Mahmoud Bawumia ni so ade ho wo maye
yo mechia omo ayehwe ne omo mutie nyina we ama me ka bibi se ohwe sa yewura mahama manifesto on say the key words o use reset ne kire se obefa dibi no asa akọ akire no ahwede ewo mu asa na watimi akọ nanim ena yenia yewura Dr. Mahmoud Bawumia His Excellency so dia na upgrade so tie obepejem eti 2016 ye baaye no na ya pomodene na eninanimiye ti de ma ye hu ye kra se ya pomodene no eda na yedi ye obeka ya yeduru covid period ena ye hu se Ghana na efi se ye wo hospitals p efi se ye wo mpa efi se ye wo adwuma hospital for adwuma for ne ade gina ye wo health workers a o ma be ne ade gina even though country be anya problem but Ghana any other African countries now you see ya hwe ya kanye omo di anim a moye enkofo a onim di a o ma fa se de besi bia no ye be ye ama Ghana for afọ mo to papa ifra obeka ya Euro president covid by o ka nema mienu o ka first and say I know how to bring the economy back but I don't know how to bring a human being back. Second year kai say let us use what is happening at the crisis and turn the crisis into opportunities. Yeah. This are nima mienu and now ye be ko 2024 a covid na twem no obi a wo manifesto bi ana so wo kire na ni so ade a obeye no fear dey anymore no and also the basis and also exactly in Europe Bawumia e dey ye adwuma tie ba ye no hwe infant mortality as enkwala ewu eme kwa awoso omu nipa omunya even a 3 die ya de a omu se malaria kum kwala ne ade nyina no na men cha de e free 2017 ba ye no se wonta anti se enkwala pi wu e malaria enkonfo ekoje ayaresa a omu efa efuru nyina akosoro nipa dodo a efre bibi womonya expert and I said midwives and I said doctor for who move a woman so kosoro antenatal clinic and so kosoro the na ewo form kakra ye OPD attendants aba form kakra but no covid period affected baby obi a OPD attendants ba form nyamencha de wo hwe health insurance a and the team anko for ko gia yaresa bra onko ton ho ne manyina no. In 2016, nani padodo a health insurance say about 10.5 million. Ye kasa CCR a page mu drop about 17.5 million. The nipa be 6.5 million. 6.5 abeka ho. Ni nyina ye first obeka ya obi pese onya health insurance o tim koda the state office ho. Yeah, that's true. To because beda hwa ese fidie na say. Yeah. Ba ne Euro Bawumia ada urumenti no utimi tina wo fie na ada wo paso. Why star 929 hash. Yeah. Now what's how you shoot ye near there you see ultimate edi mobo koma obia na ma say wo the app no cry ya cry ultimate nya digital ID card how phone boss near the amount ti say obia ansoro nkosala ibi yeah eti wo hwe sa ne ma nyina no a and yes ya sande abefo ne ma aba ti say digitization abba apomudene mo a emma okọ hospital afina ko delay mu ko twetwere wudin ne o card ko so card kora ayira you see ye digitization ye digital system ye health our hospital ye ku ye nimti ye kase ye be upgrade ne ma ya ye no it take bold decisions ti obi betimi atena nkwanta na se pasa na obi wo whole teaching hospital no wo kire say operation we obetimi aye no ho fa no to table so your friend telemedicine no we hear digital health na wo team de abefo ni abehye mu a ke say obi anya ayaresapa ye ka say by 2030 no say obi enya quality
e-health and telemedicine so remember no
telemedicine no say a general is say ye the use digitization ama opese wo fie kura obetimi afa o mobile phone na wabu kache doctor bi say doctor bi wo ho bi a call system bi wo ho ene me sorry me nisu brain kakra be wo hypertension e manema na wa kire ode also ye
enti beto ase ye a obite oti region pasa wakọ ne health facility ebia ne yare no the doctor na fi say ade we de ano eden kakra nti nka enka no nka be ka say ye be refer no if you pasa hospital na be na ba ho general hospital and regional hospital but esa ne telemedicine nti doctor no wo pasa no one doctor bia specialist bi wo ho regional hospital be din komo na ti say hu hia say ye do be to ambulance mo ba ho na ya hwe wo ho that's the telemedicine
and no opese okọ na chiri kura itimi unya gadgets ni si ebia pasa hospital na wo won so obi won bia na consult room na say na office ti otimi hwe patient no e direct to kura ma otimi yo fasha
away
enti eno na ye pese develop asa na obi develop ko ani mo no o say wo digitize
system
no your system
enti no e-health no
any e-health
it's a telemedicine is part of the e-health system na e-health no so na me say yes back so wo say nei enka no say o ya na hospital na bia like clinic na ya show bibia o card no ho ba wetu kwan abankan na yare bebo wo Madina Pentecost Hospital ye ni wo record bia ho
yes
enti ye tumi hu po say bia last week no ye show walate ene ye ma we dru say how is the e-health fixing this gap
eno na ye pese o say ye electronic medical record system tunya electronic medical record system just be bia computerized into your computer so enti no ane say e bia do free late health center na do ba e bia dodowa say kododowa na say ko tetekwashi ehia say kukuru wo fast nyina ko fa bra ne hwe ko fa wo series nyina bra me hwe da bi eno ane say doctor no a wo late no e ma doctor no a owo tetekwashi hospital no say wa man no yi say this patient these are the pictures ti enam electronic system no
obo ni nyina nkopie baby na okra Ghana card na yare abowa based on your card and crampon they be retrieve
based on your records, based on your card because if it is linked to your Ghana health system card system say because you accident in your fasama maybe we are allergic to BB and I say because our blood group you everything they share system to be here say ma moja in so we O positive no say twen ya
nti no ahase
eno nyina ahase but the basic you know here me electronic health
which has
started in a lot. In fact, all the teaching was
the upgrade, no, and the work manifesto. It is a new catch or say resetter. You have a choice.
Yes.
Based on their Dr. Nsia Asare reset they be fa yes yako cash and carry. Reset they be fa yes yako card hospital card and this are
yes.
Reset they be fa yako Dr. Tro referral amount say yemfa wumfi pasa oti region and from 37. Upgrade here Dr. Mahmoud ba o me ka ho asem ne say ya chance ye e-health ye expand no na wo doctor do work pasa no into many doctor what te we friend say 37 and akole bundin komo no hwe wo pasa wa na hu hia so betu kwan aba
che di more dimpa hu say
yes
fabra ne hwe
ana say upgrade ne say nei no wa be piem e wo tamale enso na bia wo te ya saman kese ba ye bo Ghana card share system no mu a you bet to be pull with basic information no na you bisa wo doctor na once a man can say
thank you
and now my authorization you have access to the way na yembo na yenhwe no
thank you
say be all allergies bi e be drobi na yese wonfa and e drobi na for the last week say obe fa bi mu a ni nyina be wo system na dey hwe so the choice between upgrade and reset when it comes to health sector is quite clear. You are resetting to the days of cash and carry.
Yes.
You are resetting to the days of waiting for weeks as an Osaka health insurance card. You are resetting to the days of renewal weeks. And as a will be protected upgrade now upgrade ya kwenim. Where now what's the doctor him now yet renewal of your Ghana card. Ofa phone who you sue up now will register with the Ghana card. With doctor now with doctor one kind aiding come. That is the upgrade. So I think the choice is quite clear.
And the resetting crowd can say all the health infrastructure in and after in orbit transit or 4 years. You should be 2-3 years or him. So be resetting. No wa hwasa na obedru ho no.
Na time cross.
Time continue.
Ono so kra don
agenda wa wo kuru mu a ebi a enuru ba bi a betime awie no.
Afi no so be resetting.
Afi no be resetting.
Obe ye ni nyina awie no na.
We ye awie no.
Ah obeka so beto so na the time aso.
Iti reset no. Also Ghana fo nyina bi ma ehunu se we are up to something.
Yeah.
Iti we be reset here we dey
kwa echi. Anya hwe krampo no. You should upgrade because upgrade no takes care of fixing their SSA enko years see fix no. Na side improvement ababemu. And we are far better. That one I think there's no doubt about that. Okay, Dr. Patrick into.
The no first year be setting up. Who say ayi buy no COVID buy 2019 COVID-19 buy a first one. And that you pa say ye to sin e wo near pii mu. For example, say what who say first to one some years ago. They fa okwabrane oba wonyem a okope okwa wo a emoji etu no insuo ato enye ye kwa ne ho nyina o Ghana nyina na ye wo asphalt wo so enye bridges o Ghana nyina na bia ye wi eguso a ye ko ye timi de eba newspaper simo ne TV ne bibia so ne radio so ekukuru oba no te oda pranka mu ana se otimoto so na konfo nan so moto no ye de litwa. You see, ibi ne hobiem. Moja na ohia no. Yewura ba omi ada woro mani yewura kufuado. Nimdia omunya ye ne ade. Bo hu say no. Bo hu say drones no ibo ha.
Oh, zipline no.
Zipline. Yeah. Itimi e de drone no moja no ko ekoma ni pakoro baabi. Eno, you see you 6 distribution centers. Ye ne the largest drones distribution center in the whole world.
So dey so de kuni papa o.
Yes. Yedi bi pese ohwe manifesto no be ka ho asem yedi bi no be ka ho na cover almost all the regions.
It's about the sum 2 am kra
wo kawa ohia wo wadru a ise yeni be bia yedi wo wadru no kogu yedi most of them akogu drones distribution centers itinye se bia yedi be gu nkran kolebu a wo wonka obi a for about 1 year na obiti ebi a lambusi a wo ye afu ho a wo eka no ana ne duro ho na asa but we know what distribution center ho a car ni pakro no anadwu de suom eno ane se okoso within 5 minutes no mo hiase de ba nkofo a wo nya sa ho mfaso no wo mo aba abontene ama pia beka endi a wo nya ye free drones ba ko de ba wo beka ye ba ye no BBC ye de kutwa ma photo because no say drones e twa photo no bia
so women organizer
women organizer
I also drone be so mo mayen hwe ye kase nyina na mo yi drones na e deliver and drone bi na e mayen
enti wo hwe de amanfo a e cover areas no a obehunu adepa yewura baomia meka drones no asem kakra adabi sabe na mo director general of Ghana Health Service me wo ho anopa bi be na ye wukuada ena me hu say menya call na ye vice president baomia no so doc or California, San Francisco or Silicon Valley na akohunu adibia fi se o se de bi Ghana ye de ba ya pomodini mu na me wo ho na me se me wo ha ti o da be no metime ho na me so mba so mba echina kra omra ti ho na young men two young men o buka chiro mu se zipline for se o mba be duru ha na ye Wednesday ti by Friday morning no mo mobile office ti Friday morning ti ho na omba ye no so we see convince Euraba omia che se o technology as
yeah of course yeah
ti omba menche no edi 5 minutes na mpaja mensa and you call minister for health for the health keka amonsem within a matter of about a year of all the resistance and e bie di kan ewo omenako
yeah
ye de NDC for any MPP for select committee for a call Rwanda no mo waye ba kope moja nkwa na omdifa ye kohwe ye ti conference room ho na omi na obi apaja ne sase o sade o muka na omo ntiase ibisi ye fa to ambulance ye fa ko yewe eti eho ye yes adwuma no wie ye call Mr President ho also gitu mo esinsa contract ko call ye no esi nyame ncha de ye wo ba ko ensia
ye ma menom awo ka wo mo mogya tu no esan so we chichichi no ye be fa no kra free baby awo no e de na ba district hospital no na mogya tu
wie no
be ne you know yetumi e de drone no supply mogya
na de kra e de no se e fe ba kokra ne se e say no nam se drones ni ti no mogya no blood bank for no national blood bank for no e chichim ti mogya koto ba ko no e betuma yi bibi e free bibi plasma and red cells pack red cells ti ba ko no ti ndi mani pa bi no ye no ko hia plasma ko no ko hia pack cells ba first so ye fa ni nyina na de aba
yeah
cold chain system perfect womo system no ye di ye ya ye di etiminya na minus 80 degrees san ye nya ye di bi ba Ghana ha during the COVID period no mo ebi wo mo okoho na akohwe a is a complete modern store
and it's working. I mean, we share the number of deliveries. I hear over 1 million.
Yes,
over 1 million deliveries.
Yes.
Na I to
and
see ana mo janko no supply.
Debi ye de ne de ka say nye mo janko any vice president because doc mo fa ne be bi nka ho de moja vaccines de won kwala ne COVID ba yi essential medicines obi hia duro bi ho hia pa na bi ni ho a quickly mko.
Oh, so it's more it's like say even almost everything say emergency in corner the cover ho.
Yes,
say Nsia Asare deliver a friend say exams
paper yeah and abahwe a apart from we nyina no say ye de na any wo mo ye no you can say any essential medicine and now obeka ya COVID by no na ye wo two laboratories ko lebu very Noguchi any KCC a okumase no na omo de fa samples ediba Noguchi fa samples edeko KCC a ko abra yenya a lot of labs a free tool enya about 50.
Into reset of this basically means that
we are going back
to the days owo ekobi and we
because obi all can reset and say bibia impossible.
Yeah, of course.
Into reset and say you free possibility akọ impossibility.
And Dr. Mahmoud Bamia is preaching upgrade. Upgrade ne say yen fa bi kra mbeka ho. Na baby aka sisi emiemie mu no so. Emiemie ni etumi
ku. Na yentimi ku yanim. In the COVID fences zipline e say no say ye be ye the first no. Yen kola no ebi ko Rwanda kusua de omusi o ma Rwanda for na betu omu ye adwuma. E say miracles. Onim say yen kola no nimdia omu wo technology mo no. As we speak now, the whole of the world, one of the director of operations, Ghana nearby.
Oh, I see.
There are two young men no more HRC or her. Also, new drones. I bet me be deliver na sako.
Yeah.
Young call me no wa engineers are need a
developer. I see.
The FAO mukura bi em say ofa o ha mu chichimu aduesi 60% of their workforce very quality people maya.
Nice. Ghana ha. Okay, to
come na kwa manu do so che mema.
I see.
Almost e dey kire secondary school ni JHS for ho no what artificial intelligence in a digital system means. Yes, e bi akohwe ni book mo.
And Nsia Asare mi hu school bi wo me na ko mo say ya na drone center for the bus school no be kasa.
Na o mo so ko akohwe de how it operates.
Okay, doc enti
eno ba ko no. Enti research na kire say maka infrastructure ho asem. Research na kire say ambulance system na egunu e ba na ye 41 pe.
Ghana
nyina yura ko fo sha ase ne ye metatra ho na so mo ko to bi ba ye no 30 no ko to ba ye na ye sprinter cargo buses hwini mi hu ambulance a ye to be si wa sa na DVD a be yishi by ye the 307 new ambulances well fitted state of the art abeka as you say make us say in your district and as a bia o in 261 district but all the 275 constituencies will be our ambulance.
In the crab,
so swab so kolebu for will be wo konfanoche ni ade ahun so eyu so ye.
Yeah, ebi na ye hwe nti ambulance bi ya na hu pictures ni videos ni ye hwe sisi.
Nti we na kire se yewura ba omia e de sa upgrade na ba amade ye nya from 2017 e be pim na no ya hiem kena na ye move bi forward.
Okay. Now if I say doc, this issue of infrastructure direct, definite answer. Nanado Danko Kufado, Dr. Mahmoud Bawumia Abanye. Health infrastructure ben on way. When this for say year one po. I'm say back here.
Now saying me name am so or you one of the spokespeople or you ma confirm or lebu or a professor or we money there because I am more fast.
I mean no.
And I'm in share or policy dialogue.
Yeah.
No say ye hospital back.
I almost say back here.
Question Busia no say so wo kolebu or say I. I'm so this all quite actually and as an officer hospital and say yakokuru bi so akomamfi yakosi new hospital there be I'm catching and say mortuary road or mortuary junction behind the NTC NTC for na then chipe kwa na down and the chibu mienu there's a magnificent state of the art specialist hospital
your friend saying
your friend urology and nephrology.
Oh, I've seen that hospital. But I think we have those pictures.
Yes, urology and nephrology.
Neurology and nephrology
center.
Now what am I doing?
Almost every prostate. Any and I will be a renal problems. They say renal failure. Almost dialysis center. I'm saying dialysis chairs and
but Paul, look at these pictures. These are very nice.
Beautiful. Best or
what can you say?
Operation ni bibia ho na ye hwesi say no ho na be center of excellence. So na me call into say aye na na dialysis ye oba ye manifesto no mu ye ya hwese dialysis nko a ya hwe chronic diseases. So oba hwe a ye free bibi non-communicable disease and those lifestyle actually ti ye hwe no from beginning what causes it. How do you say na obi hu ne ntem no so ano ntem na dialysis no just a stop gap treatment
abawie no why
abawie na we eno kra say ema yare no nko so yare no the twato kra ye bi e friend na transplant ti o say bi call India ko ye
transplant South Africa
ye kasa say no Ghana ha no ye ni mra e bought sa tissue and organ transplant na say in fact omukura sabi omkoye ekope emma na omoye IVF na mra bia ni ho a ebo ho ban nti ye the policy akọ Ministry of Health amo ahwehwe mu a be back cabinet
se no ya shase aye
shase se bia ye ntimi ampasse sa
kidney transplant ni sa no normal
ni kidney transplant because Ghana for doctor for bit my kidney
nti no center na beboa na sa na menye
center na beboa ye be ye bi ho na center no aye center of excellence a e betimi attracting confor from amanone. They said they come for India no. Your friend the medical tourist center.
They say obi to Nigeria, obi to Benin, Togo, West African sub-region. When him say we call Ghana neurology and nephrology center. But it's a very beautiful edifice. It's a big facility. Big facility.
Macron need to say as a president kwa commission. Your commission we are near we. And so much share dialysis machines no. Almost we are a very big dialysis center. We meet my dialysis be twice a day. Just
that was our facility.
Was our facility.
Doc, and then what else?
And look at home. And now let's check room. Where you buy no. Okay, only Eurojet project.
Yeah, they are conforming here.
Eurojet project and 9 hospitals.
So the president conforming say 2000.
President conform April. Let's check room. We're gonna make a committee. I'm a conform. April 2008. And Minister for Health. Area Koshiga Onyan Baby ko any Minister for Defense Samere area Kandapa the Minister for Defense kona dokofo stand the presidency for president and almost in Sankrata omune Eurojet indexer almost free Egypt to almost in Sankrata no scanone a free Barclays PLC and eba and a core cabinet and the cabinet they call parliament. I think somewhere in is it September, October, and the cabinet approval loan. Say approval loan and say loan.
Yeah.
And then me first be man Ghana for a trapama and DC for. Betra ho. Kaya maybe cut sword first. One regional hospital.
Yeah.
Until for first 4 years in I want to be a project nothing. Until one regional hospital. And Kumasi Regional Hospital was Sevilla. Baku Konongo, Udumasi. baako wɔ tepa baako wɔ twifupra so baako so wɔ nsɔkɔ baako wɔ kwabenya nti 6 district hospitals and 2 regional hospitals and a military hospital. The whole of the 8 years
British was Afare.
Okay. The whole of the 8 years NDC BD about so mahama or vice president or president for 4 years about 4 months
it is a 9 Eurojet project here on Peniko for shares here. A BNY and this
for we not even one
to what my baby. What's the status of the
and no yeah Kasane. The first one, era president, the Kufuor Kopa Hontoma in 2018. Opa Hontoma can say, "Sa project we a project." I say Ghana, a constitutional rule here, Juma. A fat president Mako and
4 presidents.
4 presidents. President Kufuor, late President J.E. Mills, President Mahama, and no, and Yamen Chadie. Abawa on over Pahuntuma to Oyeno. Second one, Kwabenya, Ga East. Yes. Third one, ye Pahuntuma, Tepa, District Hospital, 60-bed hospital. Fourth one, Pahuntuma, in Soko, District Hospital. Fifth one, Pahuntuma, Chifupraso Hospital. And a 6th way Pahuntuma, we are Pahuntuma, Mojuma, Economood Massy.
Into all these hospitals,
we intimate who said your copy is can buy. And I said, your buyer, one way who is Sikano, what now was all fair wage our dears for Sidama Bushia.
To from the show.
Now, what to from the Asha, who would also a day a yen cacra, no jay. And I said, your buyer now, one no copy is can buy no Bushia for direct. As if for Abano who say, "Osi we and we mu Nsia as we speak now." The 7th one, I say we are as make us say no. In Fideli in Egum, we the Akaneka light, electricity, connect. The Aka a quine because Kwana or not bridge be as I make us say, you might a bridge in a way, coveter. The oil contact I catch him say, Bosumi Asu, I'm say, very 2 weeks and obey we quano, Cocopa Hontoma. Aferi hospital and then ache by a ferry crime fidie in a hospital no more. They say make us a homo sewage system, soldier for no radio, Kwakoye Mojuma. Now a car accommodation and we and omit my yard.
Is it a coacha? A man Peniko for Eurojet hospitals. 9 no chance here. 8 years and this is one year back. But on man Peniko for Asifo. Noa, Nimia Bema, Nana Dranko Kufado. Abewi. See, we emu ni we emu watch out yeah yentimi bia yentimi wi ansa na yewura Kufuor free pass but me say yewura ba omi ba of course
ba to so no or complete salaga.
Okay, and then which
to so bi mu yenye nkofo a ye ba bibi wo ho a yenye ba me kire de yeso ye hia ase ya hye hospital new one ase ye ni ayiko pay sika no ye ba ye ni ye hye ase ene ye wi eye Aduananso 47 completed.
And you are saying that 47 what?
Completed facilities.
Let's put this on record, Doc. Or say there were 47 hospitals.
Yes.
Now the Danko Kufuor Ankasa. And no Kofeska. And no selected locations. And no Koya hospitals. Mako 47.
Yes.
Yes.
Hospitals. 47. And isolation centers in our best
47
health facilities.
Okay, Mr. Shamo, let's put that. So let's send a work manifesto.
Yes.
Let's put that list up. The list of the 47 completed health facilities. Hospitals, isolation centers,
and hospitals and clinics.
We should. I think we should project names. No, Nina no be here. Doc Macho to us.
And
location, the name of the hospital, the location, and all of that.
Agenda 111 so.
Of course.
And yes, I share 17 hospitals and can't get the 111.
It's 47 hospitals near hospitals, and then out of that, outside that 47,
there are 17.
Yes, I was 17 hospitals.
And can't agenda 111.
And of course, and come.
And no matter baby, including other projects, is IPA, MSDI for no way. And SIF for so ye be.
Yeah.
And no count. And a sour 21 treatment and holding centers.
About 17 hospitals here, and I check account. Because last week,
and I chance account. I
chance I think we should show that video. The video of Dr. Mahmoud Bawumia commissioning the Achiase District Hospital.
Yes, Achiase
District Hospital.
47.
47 hospitals now. Dr. Mahmoud Bawumia area no.
Yes. Obibia.
Oh, and okay. It's no me no kase yeshi 47. We Achiase District Hospital. And this hospital is not part of Agenda 111. No. And you're part of 47 hospitals. Now the Danko Kufado. Okay.
Yes, sir. 21 treatment centers. Who said got COVID by?
Edukrom ka we one and patch with them in Toronto. Edukrom hospital ka Achiase group. And I think we should show that.
So I'm a hospital.
It's all these pictures, these videos here showing hospitals are
40 beds.
Nana Adodanko Kufado. I see district hospitals are we see us.
Thank you.
I don't know. Agenda 111.
And yes, sir. 21 treatment centers. Any isolation centers. Danko Akufo-Addo be shasia emu edumi ensa 13 wawie.
So 21 treatment centers no. Emu 13 wawie. Ebi wo
ba akukura was sibila.
I think we should at this point no the list you are seeing here, the list of the 21 treatment centers. And at 13 na yewie no so na
holding centers. And sana agenda 111 eba.
Okay.
Agenda 111 eye district hospitals first like 101. You say the mean Sakura can we Karaga, Menshia, and in Kuransa can. 104 by the Freda Agenda 111. 7 regional hospitals, all the 6 new regions. Uti, Savannah,
Bono East,
Ahafo,
Western
North, and
Northeast.
We have a new hospital. And the Euro president, the Akufo-Addo, so also a candy away, you know, or promises of a new hospital. Regional hospital, Western region, Watakurade, and also the Ahiasi Musi.
It is our Agenda 111 hospital facilities. You know, what's the capacity?
A standard
district hospital.
District hospital. Maybe a depend also can say this a best 60 beds. Be a hospital be a and the urban areas of population in Dawson so 100 beds.
Okay.
I was a 60 bed hospital with my 100 beds.
Look, Agenda 111 emudu do send yewie.
Agenda 111 and also be bahadako. Number yimfuni ni nyina akire mo.
But ene aka 3 months. Yeah, yakwakoto aba. Agenda 111 104 no. The presidency here woman status of each of them.
It's your the status. It say ye kasa say Agenda 111 no. The regional hospitals no. Baako na ahya ase enti enim contractor for be ye ho adwuma ye free bi EPC plus financing enti say our finance o ma ye value for money o mo twen say debt restructure no e dey krata special
district hospitals Agenda 111
district hospitals no emu 100 and you say 104 no e kan ho asem no emu 96 ye wa asase bibia ho ya hya ase.
Okay.
It ranges from 5%. It be a fin be a share say a foundation yade to it be 92%.
92%. No.
90 above. Okay, make above 70%.
Yes.
Likely say. We be about before the end of the year.
Okay, so by December, no.
By December, and no, by December, the near to say bit me we per se you President Akufo-Addo or Koda ya or Junior Hua or the buy no. At obetimi editing there the phone in be bia Bobby home. We are here marking about 21 to finish.
It's by December no. 21 of the Agenda 111 bit me we. Others at various stages.
Others at various stages. We do 60% near the. I mean, say they continue.
Where they different from 17 district 20
year
17 na Edukrom Achiase mo eka. And I know so sounds here different from 47 completed hospitals and another Danko Akufo-Addo.
And so different.
Okay.
And the woman I imagine the one ye krabehwa e kama ne say ya yura President Akufo-Addo ne yura Bawumia a wo di animu anwene say bia ye nye no one region and I say enkoye central region maybe ka septa me kasa I say enkoye na Ashanti region and na Eastern region ne vote my all the 16 regions in the country.
It's ye be wie by the time we are done with Agenda 111 You were 261 districts.
Every district will have a state-of-the-art
District
fit-for-purpose district hospital.
So that's the objective.
That's the objective. District hospitals in Ghana terms, so you have 5-tier system. What is health system now? You have chips. May equity chips not to say be a electoral area. And a police station maybe. And you walk the second level, no, a sub district. A health centers, maternity homes, maybe a polyclinic. And you walk the third tier, a district hospital. A hawk. And now be just a doctor to who you my operation theatre or you hear my baby. It will be a area if free sub district one, which is health centers and polyclinics, you know, and I say chip centers and honey did not call. You could be a father Macolibu, Emilia no bed syndrome. It will feel one if you call a friend of regional hospitals, you know, the referral center and as a specialist
from the district hospitals.
For the district hospital, so every region will have a regional hospital. As I know, company for them, Colibune, Confor,
37,
37, or the tertiary or teaching or.
So this whole arrangement, you know, is to reduce the pressure on the regional and the tertiary hospital. Because we have a Colibune, be in the yard kasi abapa no.
Na fi no be malaria abaho. Na ye sa no na me kai se nwumre bi adwundwun ho na yewura president bu say na ma se psychiatric hospital he na wonam se pachoni nyina wo mpoa no. Osa ankafo pantan ena Accra Psychiatric Hospital 1914 yesi yen na efe na Salam no so when say o say nya Psychiatric Hospital yentimi ansi nyina o ba bia we nya na COVID period mo ade na yenye bi wo middle belt yenye na belt je say certain belt o mo bi coastal belt for no bi ti yen fan ye sa belt no yenye ba ko so wo middle belt na ba ko wo northern belt for the first time in the history of this country.
And we are sure
the war psychiatric hospital war, for example, Tamale will complete and commission this year. So
this is a psychiatric hospital in the northern belt.
Yes.
That was started by Ekufuado and completed by Ekufuado. So this is different from the 47 now.
Different, and the Kanja.
It's different from the 17.
Yes.
No?
They are
different from 21.
And now Udina Janawa was a psychiatric hospital. On a Juso municipality, and also Gusua seems a better 35 to 40%. Contractors now only very good. It will move fast.
Doc, do we have projects? Former President Mahama, and now if I say NDC, you buy is it the case?
But Busa almost several times. Say Omonchre back. Maybe we be. You buy, you know, you be inherited hospitals na all year. Obekaya, you will be a friend NMS project.
NMS, yes.
Ana ehoka $175 million. Eye dodowa. Omo wie kama eno do omo wie pa omo hontuma. Fomena. Kumawu. Garo timpani.
Yeah.
Abetifi. Ena Kasarado ewo secondary. Ena Takoradi European Hospital accommodation. Ba ko pe ena otimi omo oyewie ehyiase 2012.
And Dodowa. So Dodowa na omo NMS projects no
omo wie.
So mu jade aka ni.
So omo wie Dodowa no. Dia aka no. Garo timpani omo hu asase na so ko gina
omo bisika na omo de koye research, political research.
Omo de bi koye research. Enya me na make on.
Oh, the
deputy.
And omo say sa NMS project na nka say. In fact, it's one of the reasons why Betifi project into be started. Ade ba punto omo into be sharp Betifi project na say and say omo de sa aska ni bi. Ekoye omo research omo de koye.
And Obeka say Ayishi Central Medical Stores.
Yes, I remember.
Almost half a scan be $6 million or so dollars. Eko kataso. Yankoye omko kataso.
Oh sa.
Eko dwi ho nyina, o say omu dwi ho nyina. Eti o de ko ba bia forensic e bia anya adwuma.
Yeah, because evidence
they diverted the money no. Contractor ka so nkoye bi ma kwakoye. Eti omu ba firi abamu akono na aka enso a omu nyenwie no. Bebi okro omu hu asase de adoso no. Next karaka 38.8 million. The buy mekai, that mean organize service. Ye trans ya hwe mu a the contractors will bitim dey wie kumawu for mana ena sata kra dey accommodation. Nyame cha dey yewura president Akufuado. Enam se opesi ogya bibia to ho no. O mai ka se yenkoye ye dey aye kumawu ye wie for mana. Ye commission no say last
2 weeks of
July. August, early August.
Early August, yeah.
Ena takra dey so Minister for Health so commission no si aka abetifi
enti takwade komewu formula former president mahama ni
the project
na ne kufa
do ba scan ba
oba 120 we wie project apa hontoma ena garu anything pan na ye one district it go mbo one hospital you see garu enya hospital garu hospital no about 85% to 90% completed you be apa hontoma timpane so new district no almost nya hospital do nya 2 instead of 1 kasarado won hu asase wo kwa obeka garu na nsen okoho ko ka se ka obesi hospital ha ena MPP for mpanimfo no wo kana himfie o MPP for mpanimfo no ho no fa iron ross no nyina na o makoto 19 yeah I remember that matter
nyame chade asase a yesi garu de wo so na edru be 85 eko 90% no enya asase na omudema wo mo no ye konya asase foforo ye si hospital kama agenda wa ni nyina ese ese second part ye no ebi enya asase kese no ye na borosenti na ebi ye 5% de sa kra ne komase na omuni asase
tema west ye de no
tema west de nso beba tema west na asase
ne enya asase
se
afi de ebi ama
ze tespo but eno obi kura basa asase ye ne dia ye ka ho asase
esro mo man fan hospital
enti ye de be hospital enti wo hwe we nyina na ka bomu a na kire se abanwe ewura kufuado eni na be de eche be omia omo dwene se apomudini o ma obi adesua na de apomudini pa ka no ho a na de aduane ka no ho a de bi emu
enti kofo project ye beto ye na do aye
waye
former president mama project obeto ye na do aye
waye
na ono ankasa ne hospitals awaye no 47 we yes 21 district hospital awasha ase na agenda 111 project no so ye no odin saka ni
na 17 projects ye be to so no you see the aka yentimi nyenwe ya betifi.
Okay, Doc, the last aspect of the conversation before we move into the manifesto and all of that, you know, because now the infrastructure becomes what chechim.
Yes.
And then you know, propaganda ne kufa don che hospital baako, on che hospital baako. Ye chira hospital 47 awa ye wi. Ne ya chira 17 district hospitals I know so different one say ade aka ho. Ne ya say a chira 21 treatment centers awa ye. Na fe kura say a chira agenda 1 awa no kra ye nyamba so. It's that on chair hospital back over no ada munjan tunche.
It be a quickly, I mean hospitals are about 17 facilities are ben heritage a year. Maka formana, maka kumawu, maka takura the staff accommodation. Be quiet and quite shall see president of 4 times so omonti me and you be radiotherapy and nuclear medicine center I work kolebu. Na they work on for noche. And so ye betoi and ye complete ye a shaman polyclinic. There are 5 polyclinics and we have 15 beds. A shaman, a dental obojo polyclinic, Botiano polyclinic, Uduman polyclinic, any sigi, ewo, Greater Accra, ye betoi. If I ban this kind of hunt, ye never shall say from 2017 you win now. Obekaya now what almost was 10 hospital be a war central region.
Yeah.
On say you didn't tell or the Minukra constituency say woman present minority leader
to force
and also you betoi now what I say 26
it's these are list of projects you beto
you better know pesca to wita water region so many tolon solar bupe boom boy you be sha see wi beka ya tolon there no
buy Antoine
vice president in the copa ho
Antoine
wita there no
yeah
ye ni nyina nti ye nya projects
and this project our boy a different from 17 now na danko ekufado nso a
opa me 17 is
but more quickly
17 projects na danko ekufado ebeto ya owie ni nyina no eso wa ha
se say achiase die ka ho
yes
and edukum die so ka ho
17 projects a contombra
okay ebobo
bogoso elubo mpoho nsuayem wasadunkwa swame hwede sabronum drobonso manson kwanta mem nkwatia kwa kwaben atiwa adukrum achiase jumapo pond kantamanso
so what for
17 nti we nyina awie ena wohem kra 19
okay nti the other two
the other one no in fact we kra 26 no hwe yeah I'm say ye ka 17 kra we ye the omo wi 47 na make on Yeah, we 47 I mean baso.
Okay.
So we 47.
Yeah.
It is Jumapo Pon Kantaman so. So we are Sanyo so. Modernization of the Takwashi Memorial Hospital.
Me krom there.
Modernization of Chibi.
Okay, into we money here rehab anyway.
Rehab.
It is 17 new ones in there and no epim Jumapo no.
Epim Jumapo.
So those are the 17.
No, epim 18 cry epim
Pon Kantaman so.
So we are Sanyo 19.
So those are the 18
and the hospitals are and
that's where my interest is.
Yes,
that's where my interest
and is. Then there are clinics. What can I say? Borakatanga phase 2, so yeah. Phase 3 yakowi.
And what do saying? Because they be an into me boboni nyina.
And a urology and nephrology center yewi. And a UGMC phase 2 any be.
Oh yeah, UGMC there. Say atame o sine kufa na ye.
Yeah, the American say omo ya omo see yewi for example Accra, Greater Accra Regional Hospital.
Yeah.
Rage is not finished. Rage is phase 1, phase 2. What's the ajem? Diana Musa said, hospital be no obuwi and yes, be a bank hospital bank for this year.
But say Rage put there and former President Mills.
Yes.
And UGMC so. But there's something going around that I think so it's a matter of fact maybe. I think for the record no, it looks as if former President Mahama Nkasa only project be on one Nkasa. A chassis or you
be a dodoa
any day him
say NMS and the episode of buying over here say
intended him
a dodo one asa
oh sir
yes
oh but no more no say now yen hospital
so one more president the J late President Mills which one way ni na but UGMC President Mills
UGMC we didn't put so much here and they say President Mills na dan ko UGMC yeah
President Mills and a chassis
yeah
bank hospital any maritime hospital President Mills stand here
into former President Mahama there no so many
dodoa
there no is the one that he started and completed Ekufa da 47
yes
former President Mahama year 1
yes
doc I think say infrastructure conversation no yeah the base here now you move on quickly to human resource before then we come and wrap up with the manifesto
human resource obekaya ye buy no na there was embargo on one time call COVID ni ade na there were 4 from 2012 year fan
2013 14 15 16
yes we fan na sibia ye buy dey be shase e dey fa o nyina during COVID period na ewiase ehun se hiankofo no ye fan ni padodo pa about 56,000 health
at a time 56,000
in a year
in 1 year
into
that means now that's what you say MPP ye train ye beto about 3 months and ye fanipa.
Oh, na COVID period e be workers examine 2020. But the problem is that 2017 next for the pharmacists for buja mo no. Ne ye to aba.
Ye form.
2018 ne ye to aba.
2019
ne ye to aba. 2020 ne be ye to aba. 2021 ne ye to aba. 2022 ne ye to aba. 2023 ne ye to aba.
Each of these years in ye fanipa.
Ye fanipa. Ya fanipa nkoa e de abeka health workforce no 100 ye de 15,000 we kan ho a 185,000
yankwa
period
it's 4 years obedi o mampeni
show statistics
4 years obedi o mampeni uja ne next for nyina 13 14 15 16
uja o nyina go afa akokora
ye ne ba fom nyina
na se no o ka se uja yitua next allowance tua se be ya obetimi de bi infrastructure mu
asa infrastructure so no
uja tua no obebi infrastructure mu no and no a loan don't one with the car
na miki and say no
120 beds
until 4 batches are one for me this hospital back
we see back also what they
because that's what he said
also what they you know ebe fa if one call for now obenya adwuma ma wo mu enti o say reset ni nyina che say wo call back
yeah
enti yana call for ka say
enti no na kufu ado ne ba o 8 years no mafa health professionals go over 100.
We make a new one, a health force
over 180,000.
Wow,
within just the 8-year period.
Kakra is for the first time, the team for pharmacists for any health administrators for 1 year, no, 2020, bomo in bulk. Now, some bam, who say, woman, must say, organ health service, the team for administrators over 200. Who be sad. We will come also. Nurses in the doorson. And doctors say
no conditions necessary has it in the past
conditions
8 years no
8 years no at least on say na car waiver system or me so waka ho asem
yeah on
be try car waiver
bebo former president mahama
no twa ka we
no twa nurse for ne
any doctor for
casa no
because I can agree with him. Maybe another it wasn't well planned in Yama. There was a lot of abuse.
Into no between. Former President Mahama the cha.
Oh no trim.
Look, former President Mahama the cha.
Import with a.
It's another Dr. Mahmoud Bami as well.
Also about Bayama nurse for
any teachers. Yeah. And teachers here also former President Mahama the cha.
Yes. And yeah, Adibia with me. We say, oh, brain drainer. It will push and pull factors. The name my man called for core abrochire no bianco nya car keto ko betumi na ye uber na o de atete ho ne ade na bi ni ho ba wo betumi akraka ba na wo yusu ye cars o Ghana ha eno isa system ye na e betumi dia ye ne ama cars no bo kora ye fo no matok kora new car
because taxes there that's no betumi
yes it is what na o mato new car say any second hand tier rubber obi so cent
yeah
enti we ya ade a wo twa mu ade be hu so wonti mi na non kan say obesa state nurses and teachers teacher training allowance and am so ferry
ko no crime so Nsia wako ho akoka bibisa
wase oba obefa wo mu na ama wo mu
look yenko 2020 manifesto no so based on all these things awaka ho se mu nyina yi Dr. Mahmoud Bawumia say foundation awaka ya building health infrastructure and then no my building foundation ya building no the news are who going into the future no e ba beka and also once nti you better take such a quick break.
Access to quality healthcare is a fundamental right, and under the NPP, we've made significant strides to ensure this for every Ghanaian. Through key initiatives like Agenda 111, which has built new medical facilities across the nation, and the establishment of the National Vaccine Institute, with greatly enhanced healthcare infrastructure and capabilities, we've empowered healthcare workers with better training and tools, leading to a noticeable decrease in mortality rates and improved immunization coverage. But our work isn't done. We're committed to further advancing our healthcare systems to ensure even broader access and higher quality of care. Join us as we continue to invest in a healthier future for all. Vote for Bawumia. Bawumia means business.
It was a form of kwaba na ene ye hwem komodie se na esi koya media me ho adwumi kakra na megidi se mu bebre nso wo ho a yesu ho dwe wutie nneema pa Dr. Mahmoud Bawumia na Nadan Kukufa do aba we ya especially when it comes to health e ho se mo aye kia na e kamia ko say the edisi for Kenya nyina ne say emfa ho de waye baby kakra na aka na ye gidi say esi emiemie mu nti ento abantiam omo de ano because sembitie niema edwume Dr. Nsia Asare ene ye ka ho asem a ye twa bi mfoni ye de bi video si kire ya clearly between Dr. Mahmoud Bawumia and the Mahama former president here. Minji ni say kese to me former president kwa beji enim say ensanto abaye dey e ma no say yento abantia omo de hihye dodo ya bei ne yento ma wo omampeni ya wudi omampeni 4 years wontumi anfa nurse ni ba ko mpo adwuma mu omampeni obedi omampeni 4 years hospitals e friend hospital ba ko pe na wotumi hye ase esi wie yento ma wo ne yentutia de ono ba ya wire hospitals ne health facilities 47 yento ma wo ne yentutia de ono ba ya wire district hospitals ma ko 17 yento ma wo ne yentutia de ono me ne wo kasei wa sha se o make sure say district be Ghana Benya hospitals are over 104 hospitals in Kwan for district here wa sha se oye enti ase enim na te se ne yesi no next chapter no ye de ane se bibia no creda bibia sem da no na de ato ne ya kire ghananews kwakoto aba no de enti eso no to na ba e ma Dr. Mahmoud Bawumia former president mahama say yentoma na on reset Ghana reset ne say niema ya ye no nadwi mu no papa bi anim nti yem pepa yenko hyase foforo hyase foforo ne say ene say health insurance and auto doctor ni no wa video no e be sign the chi ene say hospitals are yesi ayenye wie no obeto le boase na 4 years no wase ya reset ne yakosha ase da beg. And that is why it's important say you better upgrade there ye ne say the improvement ba na the aka ye nyanye ye a esese emiemiemu no so no ahwe na we miemiemu ene nwumre ye ne Dr. Anthony Nsia Asare, presidential advisor on health osanso ye member of the MPP 2024 manifesto committee on health and ye di enkomo acheche ne mam bebre ya kansem bebre and then no baby Adriano. You be share Dr. Mahmoud Bawumia manifesto for health going into the future. But what the tougher highlights no in the become one some. The details in the you be with the full manifesto name. Doc, you might call baby.
Yeah.
Number one, in fact, the headline for Dr. Mahmoud Bawumia health manifesto here: provide better health care for all. Provide better health care for all. No, a poor touch any day.
A poor touch in say, you know, the Sako Shekratasi, a World Health Organization, say in fear in Pimbi, no Eduasa, 2030. Also, Ankram Krabia or tea or maybe a Mugana Kamu. Also, Timinya Ayarasa Papa, a Beno, a bra uncle Tono Honema, here, son on Yayarsano. Tiani a friend of universal health coverage, better health for all. Inti Biana and was here 2 years so. A poor church in say COVID-19 a buy no. And my country beer who say or say when year because pandemics and I say sa I reach some a bar and moko coco. It do a manifesto no. Sa pepe fire. Sebeya a dear yetimia ye 18 COVID-19 no contem are the areas in Memunina and ye can't inkruma akuma ensa yeti manage COVID-19 year no. Sad nye eka the whole world and eka no de can say one of the third countries manage COVID-19 year no. Enisi etoto na se ne hyemu kena na ye pegem na se bia bibi nyame ye bom paise nyame fa saaba ebeba bie mu a ye obabi a ebetimi ede yankofo afa that's a bigger picture. Into mo say Dr. Mahmoud Bawumia any so adin we say complete all agenda 111 hospital. This ensures every district gets a district hospital. Yes. Ti empese obi 29 e free e manfe. Hokra dey district Akuapem North. Now ka so okopa yaresa e wo
New
Duabin South. Empese bi
say if you Okre district, in fact Okre district, Akuapem North municipality, Akuapem South na Ebri, Adenta any Madina. So 5 districts in your district hospital here back up. Tete Kwashi Memorial Hospital.
Those will be a one will be a
but the name no Edukrom Hospital are ready for
Okre
people. Akuapem South for the are ready.
Thank you.
Madina ne Adenta the so are ongoing.
So you go so. Yeah. Tisani dikai. Ye tosu mienu so ne say also yetimi in such a way say wo ko hospital no a unko hihia mu nkope unisika nke say obewu eno so ka ho bi eno na ukaya 2003 yura president Kofo eso de ye kan manifesto say se nyame ya dom ne ba ba mu 2001 January ba ba mu no edwundwene ho anso 2003 ene ye share samran for national health insurance
ene me ba mama say ndisi for the buy
nano obi ka chem say ndisi for the buy na JJ Rollins.
And nobody attend to her next chapter here.
JJ Rollins had the buy, but they may you know when say they are no person watch it. Africa almost say we cry the buy 2012 and over here.
Free SHS course on the buy in Ziana.
To be a cry na wa kwa so no here.
I NTBA.
It is sanity nti wo koton ho ne ma na dokọ ho yare. Wo yare na pese de ko ba bi so a ye fa wa na de wo ko ambulance wo.
Second one recruit more doctors.
Yes.
Nurses and other health professionals with improved conditions of service.
Yes. They say we are seeing many na the SC and say onim say COVID by no ama mp o ma no mo ye nurse for ne yin na bi kura jaye o mo ko nursing training school and ne ma ne but ye nyame ncha de because of free SHS. They say nkola no a mo so mo ko nursing e ko medicine unya degree one kura unya 6 years kura unya medical school ko nti pesi e training nipa no pi na yetimi so fa wo mu nyame ncha de because of agenda 111 yesie ni hospital yesie nyina no ke se kwan bibie na wafa obi awie no also utimi mani pakro no tra ho na utreni no na wo mane akane ya ode be ya adwuma tu nya ni hospital a ukoye adwuma apart from salary a wo sabeka no be a wo ye adwuma so hia pa se me ye surgeon wo wura theater na wo pa fidie bia ye adwuma na wo nya bi ya che mi bia wo be nu nkura se wo ye adwuma no ti be bia wo ye adwuma na ye kama the tosu mi no say pakro no so ne daachi odwene ne daachi ene man kofo kwa abrochire no ti wafa no wie no wonya baabi a obeye adwuma no na onye baabi so a odi ntiri beto ti wo hwe a e wo manifesto no even under infrastructure say
yeah housing
enye aban ne besisi da no ankorankoranfo bi e ya baso besisi da no e pese e di bi ka hospitals ni nyina ho nti wo fa ne bag a obekọ 3 bedrooms air condition wo ho empa ne bibia si wo no akotena ho no wa say obedi be mfie miensa na waka kuru
o ka say sa conditions of service bi and na health professionals doctors for bi sa and more mampeni catch up so on you ready so no be negotiate.
Thank you.
Now no he has seen so much strike. Now strike NFA and see why you doing and I go for buy you. To the extent say in fact I think we have to play that video. Doc my be sema ni ambo sa video no. Young health professionals are omugu control accountant general egu Ministry of Health car park let's say yen form odwuma ebi mu so say yen to market tuemu ni ade. I think we need to watch that video shortly and come back. Timo be mbo sa video no quickly ni enkombra.
The doctors insist that their leaders are in there to listen to what government has to say to them, and they are not there to take any decision on their behalf. Their leaders are there to report back to them whatever they hear from government, and they will finally take a decision on their next line of action. But they still maintain that until their monies hit their accounts, they are not leaving the premises of the Controller and Accountants General Department.
We are expecting that we are paid as soon as possible. We are only here because we want our salaries that we have worked hard for and we have earned. So that is the bottom line. That is our hope, that we are paid.
But what happens, I mean, if you don't get paid today? Because, I mean, we heard the finance minister over the weekend say that your money will be ready in 2 weeks.
Oh, yes, but we are very optimistic. Okay, it can be done. We believe that it can be done, and it can be done today and not in 2 weeks' time.
I expect them to give us our full money. That's all. That's why we are here today. So they should tell us something that will make us live. And it's only the money, either the money will hit our accounts or they should give us the checks like what they did for Konfanochi Teaching Hospital a few months back. Because we were as a group and they decided to divide us by giving them checks. And the hospital was laser reimbursed. So that's what we also want. We want the money. If we don't have the money, we are not leaving.
I also want to admit that it's taken us too long to have addressed the concerns of the junior doctors.
This was the situation under the former president when he was president. Stranded young health professionals simply asking to be employed, others also simply asking for their conditions of service to be improved. This is him. Now, when the doctor said, or improve your more conditions of service, Mr. Mo, and also moment in Tiadia or Kokaye. Sasa we Okaye Podon Ghana. Ojina far away Rwanda was a Botswana. No catch them say the crew strike we all know obedi o mampeni. When who strike sa ma strike enye na hwe. Why so dwemfunu? The famous Odwemfunu, the famous Minsro Sekai quote no. I mean,
trade unions and everybody sees that government is in a vulnerable place. And so that's when demonstrations and things, agitations for increased pay and all that begin to happen. And because of the sensitivity of the period and probably the fear of losing elections, government, normally would give in to some of these pressures. And before you see, the budget is out of sync. And then when elections are over, and government is installed, you have to start the belt tightening all over again. The advantage going for me is I've seen more demonstrations and strikes in my first 2 years. I don't think it can get worse in the second 2 years. And it is said that when you kill the goat and you frighten it with a knife, it doesn't fear the knife because it's dead already. So I have the dead goat syndrome going forward.
This is the situation the former president is asking us to reset to. What's he reset it? You reset it on minor healthcare no into the situation that you young people picketing, placards, Ministry of Health, Ministry of Finance, Control and Accountant General, Dr. Foss say anka my conditions of service in kwenum kakra or say or no and yet mo strike am can no ye ready so new bia ebe negotiate and then waba or say yen to abama no na on reset Ghana. You are resetting this country into this situation. And that is why we keep saying, say, what we need is not a reset, but an upgrade. So that the aka yen to me yen you bet me abwa your honey to any year. But the year to the we don't have to reset to destroy it. We have to protect it once we improve upon it. Doc,
until the cano say we fan for no so no. We say we Ghana ha no a buying fa workers na adwuma wa pomodin so ye no. 99% of workers in Ghana are buying na fa wo. But akwa hospitals no. E pese ye ma wo mu so etimi ba no etimi fa nipa kora na ye de ma wo mu.
Okay.
O ma ye ready so betu ya o muka.
Okay.
E say nya nko fo pi o mu condition nyina be the same. Ye to so bi em say o ba fa nipa kora na asan atu ya neka. Ye to so bi em say nipa kora na duru say ni promotion na we promote no. E na sebi o ma ba ko nkurase no a hoye hard to reach areas in Yamanema so no. Ye will be a friend no rural allowance conditions and that table so that and no you ba o mi ase oba obehwe no dey aye
the housing and accommodation
and a car waiver allowance
amukọ rural areas
and a sa waiver na and so this for the tray mo no so no ye hye ne ye ya shase ye kura di e de beba ama nurse for any pharmacist for no bia nya bi se be ye obenya ne car obetwi na wohwe credit system na eba no so a credit system na kwa obetwa ko awura ka ayi manufacturer yi wo bia ya te duties no so ama wo na wo so kwa jiwo ka
once you kakra
opeso okusua ade so a no ko ye postgraduate a you say doctor for there no scholarship secretariat for the tuition fee
specialist training no
ye de be omu nyina so ba we ka ho bi no condition.
But I read here say specialist training no ebe free.
Yes.
It's all health professionals.
Doctor for the free. Until all the other health workers.
Until Dr. Baumia, all the others.
All the account. No Sunday.
A reset would remove some free specialist training for doctors, you know. But an upgrade, ebe keep specialist training for doctors free, you know. Necessarily all health professionals.
Near sign even for allied health laboratory for also Yama Omusu College.
And so we are very simple docs. You can say a table. NDC waha, MPP waha. NDC a reset, MPP upgrade. NDC research now. Not just say and doctors say call specialist training free, you know. NDC research and be
yes.
MPP research no. Ebema doctors free, you know. At was normally the other health professionals are better. NDC research and they say doctor for waiver no. Yes, and so you free ho. MPP research and they say doctor for all other health professionals. Ebenya waivers for omokasa omobeto. NDC research and they say so one for yasem. MPP upgrade ni say ukwe kurasi more housing allowance, more accommodation allowance. So I think the choices are clear, yes. and the way forward is quite clear for
it's very clear.
Doc, third one, I say bring health care services to your doorsteps by A, completing the digitization of public health care institutions under the e-health project. B, scaling up telehealth services. C, establishing 2 additional sites in addition to the existing 6 at Fonsi and Kintampo to enhance drone delivery services and to ensure total nationwide coverage. And at D, ensuring the interoperability of the National Electronic Pharmacy Platform with public and private healthcare facilities. Sanyama and Nai and
say omo ane say ebeye ama on say tini ye agenda 111 no. Tina ye chip centers, ye health centers, ye de abefo enema beka ho telemedicine. Akese bi wo kra ni say okọ hospital. Ebi a wo ho wa fedru woni so bru wan so wa fa wo phone ukọ app bi so a go for ho betuma fa phone call center nyina bebem e be san ye bibi e friend no e for e say Ghana Health for call network of practice it is say health center wo e bi amanfe ene de wo adukrum wo mu nyina ye network tina eno ne hospitals here 24-hour service already by e be shebo kina se be ha say be a midwife no and they off but there's a midwife next door ya platform ake se obi kura anyem no wo midwife ho a bi ehia se de no call hospital ti midwife no e be hwe na wo de records no e wo mu nyina platform so na bia doctor na wo hwe go satisha ngana ko yi no e wo tete kwashi hu pe o so mo refer no mrante because obi hia cesarean section ye ko ye bi 2018 e wo Northern region at maternal mortality so to almost about more than 70%.
I see.
Iti abefu nema de all the shebi bi mun telemedicine nema no. Ya network of practice. yɛayɛ agenda 111 and ɛne the first referral center yɛwɔ regional hospitals and the second referral center waiting to be akɔ hɔ yɛnya sɛ ɔfa no huu de ne firi otia bɛsene de bankran because dambae yɛsi regional hospital hɔ bɛtumi no akɔ hɔ na wo use a telemedicine and other things ni nyinaa no ahwɛ kora hospital ni sɛ opie firi ne fie health insurance yɛ adwuma health insurance so ebi ebeduru hɔ ɛno nyinaa ka ho a ebi
and the interoperability of the national electronic pharmacy platform no
yes nti wokɔ pharmacy a ɛno asɛ wokɔ platform no so a ebi tuma kyerɛ sɛ kɔ so ɔbɛhu sɛ ɛduru no a wohwehwɛ no
menya bi wɔ ha
wobɛnya bi wɔ kofi pharmacy nti hia sɛ wokɔ nante kɔ ns chemist ne ayi abi
ɛbɛn
no atɔ
offer incentive for healthcare workers to buy one vehicle each with engine capacity of up to 1,000. They say no, you can't want some
incentives.
Some incentives. They say health professionals. And this time it's all health professionals.
All health professionals. Not
only doctors. All health professionals. And Dr. Mahmoud Bawumia at the EBA. And then the final one here, ensure compliance with existing deprived area incentive package for health workers.
Thank you.
Also,
I can say, rural areas, you know. USAID for IS steady be huno ya categorize the country and higher less rural where higher severely higher the most rural area obi kono o feeling cry no ko transfer ekura na se wo ye adwuma ehia se nyame anim o se man allowance bi ka ho o ko hwe a obohu ti anya se bi a o wo ba bi a obi a gi salary pe se ba bi o ye adwuma no nko na wo ho a wo brand ho ko no ho a eno ene allowance a adi awon krata so ache nti Yoruba omia so oba obetra se no de aye adwuma ama nkofo
Dr. Anthony Nsia Asare ebedo wase wa cheche nsem no yie pa na megidi se obi a otifi a otie wa ohwew ohwese na woti ato obo asa cheche nsem de ebefa aye se na oman no ayaresa nsem sitie de ya ba bedu ene any initiative who Dr. Mahmoud Bawumia wona I am very sure say the decision between the reset of our health system and the upgrade of our health system is a very easy one. And like we always say on the next chapter show no yede necessary assembly no any baby esi da no yede beto ho na yama the reason to vote for Dr. Mahmoud Bawumia na nyame yadomo a ya woda eda yenim yi ye besan so ehia na ya sen afa another aspect of the MPP manifesto na ya ka ho asem but no sign off na meye no mesremo video na me di ka se yembo no the side video no be sign off na ya pon ye be bo Dr. Mahmoud Bawumia ansem o kan ye embra one CEO se wo Ghana ha ehia the CEO summit nsem o kan ye no ye be bo sa video no ye bo wi a na echese makramo a enisa nyame yadomu a ya woda ye besan so hia nyame hia mu nyina.
But that collapsed economy is performing better than your economy that you left us. We have created more jobs, 2.1 million